Hi everyone, this is Stephen Judge, clinical naturopath and nutritionist. I'm coming at you from the Holistic Medical Centre in Sydney, Australia. Today I wanted to make a video about a topic that I'm finding myself talking about quite a lot with recent clients over the past few months, particularly women who come to see me and are experiencing quite significant anxiety and a lot of hormonal symptoms that are typically related to estrogen dominance, but a lesser known fact to a lot of people is that one of the key underlying drivers of these symptoms is something known as histamine intolerance. So it's something that's been on my radar for quite a while in practice, but I'm only now starting to meet a lot of people who all at once who are presenting with the classic symptoms of histamine intolerance. The universe tends to work like that, bringing you something all in one go. In my case, people back to back with almost the same issues, as if there's some very important lesson for me to learn. So aside from learning how to help women navigate histamine intolerance properly, as people are still individuals and do vary slightly in presentation, I thought I should probably try and put some foundational important information out there about histamine intolerance and particularly its relationship with estrogen, which is crucial to understand to really be able to effectively uncover and treat it properly, so that in effect these women no longer have intense bouts of anxiety and other symptoms directly related to histamine intolerance and having too much estrogen with almost no relief. This is a very common scenario. It's generally something that goes completely unnoticed by GPs and conventional dietitians. I've met patients who've, done the rounds of kind of conventional and complementary and naturopathic treatments, all the typical kind of foundational immune and gut and mental health support. They're trying everything they can to get on top of their mood and intense symptoms, whether that's with herbs or nutritional supplements, whether that's treating pyrroles or excess copper, whatever it may be. These people, they haven't seen any long-term relief trying to address these things. And that's an awful feeling, when you're doing everything right on paper, not to mention you're trying to do all the right dietary and lifestyle strategies, and you may think you're eating all the right foods, but you just seem to be hitting a wall every time. So as I keep finding, many, many women experience histamine intolerance, and it's related to having excess estrogen levels, and the two kind of feed each other in this vicious cycle and drive symptoms such as intense anxiety, gut symptoms such as loose bowels, bloating, cramping, and nausea, classic respiratory symptoms like congestion and postnasal drip and sneezing. Headaches and migraines is another key symptom, and many more. So if it sounds like it may be an issue for you or a loved one, listen closely, because it may be something you haven't looked at, but you may need to assess for and address. And it could be the missing piece in what can be for some people a very complex puzzle. But if we can identify and nail the underlying cause, and this is it, we can see some dramatic shifts in these symptoms, which is what we want. So we've got to take a step back first and look at what histamine is and what I mean when I say histamine intolerance. So histamine is a compound involved in the body's immune and inflammatory responses. So it's most commonly known as being part of the allergic response, which manifests in people as hives and asthma, redness, the typical hay fever symptoms, sneezing, itchy and watery eyes. But histamine does in fact have numerous other roles in the body, including It regulates gastric acid secretion and gut motility, so movement. We need histamine for neurotransmitter production. We need histamine for smooth muscle contraction, but it is more famously associated with the classic allergic reactions. When people hear the word histamine, that's kind of where their mind goes. But it does have this kind of multitasking role in the body. And there is, in fact, histamine within food. It's very widespread in food, and it's much higher in some particular types of food, which I will lay out. But so histamine intolerance it's a term used to describe when there's a buildup of histamine in the body due to an impaired ability of our body to handle, break down, and metabolize the endogenous histamine we make ourselves, but also the histamine that is in particular foods. So when levels of histamine in the body build up because we're not breaking it down well enough and getting it out of the body, symptoms of histamine intolerance start to manifest. So a good analogy to use is the bucket. So we can normally handle our own histamine production, and we can normally handle the histamine in foods, but if the bucket overflows because we're not emptying it, we're not breaking it down properly, we're not excreting it from the body, then we get symptoms of histamine intolerance. So the bucket's overflowing because we're not getting it out when we should be. So it's important to understand with histamine intolerance that it's different to having an allergy. I'm not talking about someone having food allergies or an allergic reaction. They are completely different mechanisms, and because histamine plays so many different parts in how our body functions, symptoms of histamine intolerance, they're quite broad, but it can also mimic the symptoms of allergies. So the classic itchy eyes and nose and congestion and sneezing, for example. But you don't have to have those classic allergy respiratory symptoms to have histamine intolerance. So when we have an intolerance to a food, such as histamine-containing foods, an intolerance basically occurs when particular compounds in a food, like histamine, or it could be gluten or salicylates or amines. So these compounds within the food with intolerances, they irritate nerve endings in the lining of the gut wall. And this drives inflammatory symptoms, gut symptoms, respiratory symptoms. It's not technically an immune-mediated response, like a true allergic response, which is an IgE reaction to the protein part of a food, where you ingest these foods and you get almost immediate symptoms. So you get the typical allergic symptoms, the hives, the itching, the shortness of breath. So that's a bit easier to figure out. Histamine intolerance can be trickier to pinpoint because it's much easier to link particular foods with an allergic response, because when you eat something you're allergic to, you tend to have this immediate and clear reaction. So whether that's to the casein in milk or something in egg or bread or whatever. But with intolerance, such as histamine intolerance, symptoms manifest in people due to this progressively increased load because they're not getting it out of the body. And everyone will have a different threshold too. So you could have a very high histamine containing breakfast and be fine, but at lunch you may have had a tiny amount of histamine, but your body has then reached its threshold and then you develop symptoms. So it's not as simple as pointing out one particular food that is causing allergy symptoms. It's an accumulation of histamine from a range of high histamine foods that eventually drive symptoms because you're not getting the histamine out of the body. So it's not as clear-cut as allergy symptoms. And so a lot of people ask me, well, should I get tested for histamine intolerance? So there isn't a standard test for clinically diagnosing histamine intolerance. There's not a blood test or a skin prick test or anything like there is for allergies. It's kind of similar to other food intolerances, the easiest way to try and see if this might be an issue is to you have to basically trial a low histamine diet for at least 1 week. A week is usually sufficient, and you need to monitor and see if you experience a reduction in the classic symptoms. So even if it's just a mild reduction, this will usually indicate that you have trouble handling histamine, and you will need to follow a low histamine diet for a longer period of time while addressing some relevant nutrient deficiencies and while restoring the gut microbiome health and a few other kind of underlying drivers with your practitioner, which I'll go over. But depending on your medical history and other symptoms, you may need help navigating a process of elimination of maybe having a true allergy. So you may need to get skin prick testing, typically performed in the medical world, as well as other blood tests, looking at white blood cells, for example. And, you know, if allergies are picked up, you would obviously remove these from the diet and hope to see a reduction in symptoms. But if these tests don't come back positive for allergies and you still have what seems like classic allergy symptoms, this is a huge red flag that you may actually have histamine intolerance. And it's also important to highlight that part of this process of elimination and figuring out what's going on is you may need to exclude more obvious drivers of symptoms. So this might include celiac disease, inflammatory bowel disease, IBS, small intestinal bacterial overgrowth is very common with histamine issues. So always keeping in mind to work holistically with the practitioner, doing kind of very thorough case taking, and obviously someone familiar with histamine issues. So I've mentioned a few symptoms, but I'll just go into a bit more detail with the classic symptoms of histamine intolerance. And so I've mentioned a few times what you can experience what seems like the classic allergy symptoms, so the congestion, sinus issues, itchiness, hives, but you may not have those symptoms. You don't have to have the typical respiratory symptoms to have histamine intolerance. So other symptoms of histamine intolerance include digestive symptoms, in particular loose bowels, nausea, kind of abdominal cramping, bloating. Some women experience vomiting, like the nausea is very bad. Unexplained fatigue. Women with histamine intolerance tend to sway on the side of having very low blood pressure because histamine dilates blood vessels. So some women experience arrhythmia on a regular heartbeat. It is related to skin issues like intense itching, eczema, kind of unexplained edema, so like tissue swelling, feels like all over the body. But some really key symptoms in women, which is directly related to estrogen levels, are intense anxiety and other mood disturbances, but particularly if they're worse around the time of when a woman ovulates. This is a really key sign of histamine intolerance, as are headache and migraine or migraines. Also, if they tend to manifest or worsen around the time of ovulation. And it's really fascinating that a lot of symptoms that women experience, such as PMS, mood disturbances and anxiety, headaches, breast tenderness, fatigue and insomnia, it's very common that they are caused in effect by histamine issues, like histamine intolerance. In fact, the majority of individuals who experience histamine intolerance are women. So that's kind of a key obvious link between histamine intolerance and estrogen. Numerous studies have demonstrated estrogen, particularly the form called estradiol, which is the not so great form of estrogen. It elicits activation of the mast cells. So these are the cells known for their role in releasing histamine when the immune system is activated. So estrogen not only triggers mast cell activation, which releases histamine, but estrogen, it downregulates an enzyme called diamine oxidase, or DAO for short. So the DAO enzyme is responsible for breaking down histamine, which estrogen suppresses. So we normally metabolize histamine via the DAO enzyme, which is made in our gut. And it breaks histamine down so that we can clear it. But if we don't have enough DAO, we run into issues with histamine building up and becoming intolerant to it. So with women who are quite sensitive to estrogen and have trouble with estrogen clearance and have classic kind of estrogen dominant symptoms like painful heavy periods, fibroids, endometriosis, this can be a huge driver of their histamine intolerance symptoms and vice versa. So it becomes this vicious cycle because estrogen and histamine, they reinforce each other. So estrogen in the body triggers histamine release, and the production of histamine causes estrogen to increase, and this cycle just kind of keeps perpetuating, and the body becomes overloaded with histamine, has trouble clearing estrogen, and yeah, this cycle just continues basically. So this is really common, but it's very unaware to most clients I meet who are experiencing this. No one's really brought it up. Most doctors and many other clinicians kind of miss it. I've met numerous women who've tried many kinds of treatments, but the link between their intense anxiety and other symptoms and estrogen and histamine hasn't been made. Heavy and painful periods or gut issues, the link hasn't been made with histamine intolerance either. And so when you go in, if this is going on for you, when you go in and deal with it, you can see awesome relief because we're dealing with the underlying cause. So the key to try to uncover if your symptoms may be related to estrogen and histamine intolerance, the key to trying to figure this out is by tracking your period, because histamine rises and falls with estrogen. So as estrogen rises during a menstrual cycle, that is when histamine is going to rise, and that is when your symptoms are going to get worse or manifest. They might not even be there, except for pre-ovulation and then also pre-menstrually. So during the menstrual cycle, estrogen is highest right before ovulation and also during the premenstrual time. So right before you have your period or right before day one of your bleed. So symptoms of histamine intolerance are most common, right before ovulation and right before premenstrually, right before day one of your period. And the reason why symptoms flare up right before ovulation is because of the dramatic rise in estrogen at these parts of the cycle. So as women reach these parts of their cycle, estrogen rises, histamine levels come up. So this is when women kind of mention, oh, well, at this stage of my cycle, I just get this really intense anxiety, or I get really loose bowels, or I get my bloating gets really intense at this time of my cycle. I get a lot of cramping, or a really common one is women experience pretty intense headaches and migraines. So migraine headaches occur because histamine triggers the release of nitric oxide. And nitric oxide dilates blood vessels that surround the brain, and this kind of leads to migraine. But you can reduce the symptoms of migraine and headaches, by reducing histamine levels and making sure the body is getting rid of histamine properly. It's a really great link to discover, because anyone who suffers from migraines and persistent headaches understands how intense and debilitating they can be, and the cause of migraines for individuals is usually pretty ambiguous and multifactorial, but based on all these women I've worked with, identifying histamine intolerance and linking it with increased estrogen has been a huge relief, because we've found one of the major underlying causes on a physiological level. So it's always really nice to help women uncover that for them and kind of help them move on and live without these intense symptoms. And, you know, this includes middle-aged women who are going through perimenopause and menopause, because although estrogen levels drop at menopause, the hormone progesterone is what begins to drop first. So as progesterone begins to drop, relative to progesterone, estrogen can be higher in some women going through perimenopause or transitioning to menopause. I've worked with quite a number of women who overlooked this hugely because they assumed that their estrogen levels would be quite low, but relative to progesterone, they're quite high. So out of nowhere, a lot of women can start to experience these symptoms because they have suddenly become histamine intolerant. So boosting and supporting progesterone production is another important treatment strategy if you fit this category, because progesterone is antihistamine. It prevents estrogen dominance, and progesterone directly inhibits the release of histamine from mast cells. This is something that a practitioner can help you with. It usually requires a lot of adrenal support and quite a few other things. Another interesting point that strengthens the link between histamine intolerance and estrogen is that histamine intolerance symptoms are relieved during pregnancy because the placenta of a pregnant woman increases the DAO enzyme production like 500-fold. So that's the enzyme that breaks down histamine. So what causes someone to develop histamine intolerance and estrogen issues? So on a physiological level, the most common highlighted reason is, you know, you'll see this in blogs and mentioned by functional doctors and whatever practitioners, is that the cause is a deficiency in this enzyme. It's a deficiency in DAO enzyme. So, you know, there are like DAO enzyme supplements on the internet. But simply saying that a DAO enzyme deficiency is the cause of histamine intolerance, it's too reductionist, it's too simple. So we need to take a step back and ask, well, why is there a reduction in DAO enzyme production? And so the clue here is that this enzyme is produced in the lining of the gut. So if we're not producing DAO because there is impaired gastrointestinal lining and impaired digestive function, we need to heal the gut. So more specifically, we need to address gut dysbiosis, so which is basically microbial imbalance in the gut, which when there's an imbalance of these species of bacteria and fungus in the gut, this drives inflammation in the gut, and it can damage the lining of the gut wall where these enzymes are made, which so damage to the lining of the gut wall can lead to intestinal inflammation and leaky gut, essentially. So if so dysbiosis, it also it directly reduces the ability of the body to break histamine down. There's a lot of evidence to support this. We know in clinical trials that people diagnosed with IBS, there is altered histamine receptor expression. Dysbiosis directly increases histamine in the gut. We know in clinical trials that in those with histamine intolerance, there is intestinal barrier dysfunction. When there is dysbiosis, there is increases activation of the immune system, leading to more histamine production. So you need to treat dysbiosis and heal leaky gut, intestinal permeability, and just restore the gut microbiome and its ecosystem to treat histamine intolerance properly. You can't just take an enzyme. That's just symptom relief. So to do this, you need to remove and treat food intolerances, which I would do. You can get symptom relief in amongst all this. I mean, sure, we do need some symptom relief and looking at underlying causes, but looking at it a bit deeper, we do need to look at some. I prefer to use gut microbiome stool testing, and with that testing, we can target very specific probiotic, prebiotic, anti-inflammatory kind of gut healing strategies. Which ones to use depends on the composition and the ratios of these bacterial species, as some are very anti-inflammatory, some are very inflammatory. And a downstream effect of dysbiosis can be small intestinal bacterial overgrowth. And this is really common in people with histamine intolerance and the symptoms associated with it. So depending on your gut symptoms, you may need to rule out SIBO as well, particularly if you've got quite chronic daily loose stools and lots of gut symptoms like bloating and abdominal pain. So there's a lot of gut involvement. So one of the major underlying causes is gut dysbiosis and potentially intestinal permeability, which causes an air deficiency in the DAO enzyme. Another thing not to overlook in what doesn't cause but can exacerbate histamine intolerance and medication side effects. So antidepressants, antipsychotics, blood pressure medication. There's a huge list of medications that block DAO enzyme production. So it's common for when people start particular medications, they out of the blue start experiencing like typical allergy symptoms that they've never experienced. And the onset of this can also occur after disruption of the gut microbiome and gut wall integrity due to medications as well. So they're kind of the key underlying causes and drivers. And I just want to quickly now talk about histamine-containing foods, because this always comes as a huge shock to people, because they're like, wow, like I thought I was eating a really good diet. Because this is the thing, they're not bad foods. They're just foods that contain a lot of histamine, and unfortunately due to the state of gut health and everything that can kind of cause gut dysbiosis, these foods are unfortunately driving a lot of your symptoms at present. So if I just quickly go through the major high histamine containing foods, these are fermented foods, so sauerkraut, kimchi, kombucha, all the rage, healthy gut healing foods. But if you're histamine intolerant, these are like super high histamine. Bone broth as well. Alcohol is a huge one. Citrus fruits and pineapple, strawberries, banana, papaya, dried fruits, avocado, eggplant, spinach, tomatoes, like all healthy plant-based foods, all nuts and peanuts, sourdough bread, cow's milk, aged cheese, including goats, cow's milk, sour cream and yogurt, shellfish, mackerel, smoked fish, like smoked salmon, sardines, chocolate, vinegar, miso, soy sauce, black and green tea. So histamine is in, I was speaking with a client a few weeks ago and they're like, that is my whole diet. I was like, well, yeah, this is why it's important for us to address this, because it's the diet that may unfortunately be driving a lot of symptoms at the moment. So histamine is in most foods to some degree. So it's more a matter of trying to reduce your total load of histamine-containing foods rather than completely avoiding, because that's near impossible. But we do have to look at trying to stick to a lower histamine diet to reduce your load. So a really important thing to understand about reducing histamine load is to eat foods as fresh as possible, and avoiding any aged or fermented foods. So you have to try and source fresh meat and fish, strictly avoiding any canned fish and avoiding leftover foods, because these will be very high in histamine. I do have a very cool PDF handout on histamine intolerance and the major foods and food groups. So if you would like that, just drop a comment below and I will message that to you personally. So a lot of people ask, well, what is the treatment for histamine intolerance? So, obviously we want symptom relief. So we need to look at a lower histamine diet to begin with, also to kind of assess whether or not it may be an issue for you following the low histamine diet for a week. So we follow a low histamine diet. Depending on how your gut's functioning, we might need to give you digestive enzymes, some kind of anti-inflammatory support in the gut. So the body, to make the DAO enzyme, the body needs a few minerals and vitamins. So to make DAO enzyme, which clears histamine, we need zinc, we need vitamin C, we need B6 and copper. It's typically usually a zinc deficiency rather than a copper deficiency that people have. But so for example, a lot of people take zinc and vitamin C, not just for symptom relief, but to help with the DAO enzyme production. And that's great, but you must, that's still not truly really addressing the underlying cause. You must heal the gut wall and improve barrier function because it makes the DAO enzyme, and it makes the beneficial organisms that metabolize histamine, and because dysbiotic bacteria produce histamine and exacerbate symptoms. So in my own practice, I do use a lot of microbiome stool testing. It allows us to get this blueprint of this species of bacteria in the gut which drive dysbiosis. It allows us to target very specifically pro-prebiotic, anti-inflammatory gut strategies, as I was saying before. But so after some time of reducing histamine load in the diet and following the low histamine diet and healing the gut appropriately and addressing other food intolerances, it's really a matter of slowly reintroducing these foods and seeing which ones work for you and which may still not, because everyone is different and everyone will have different and evolving thresholds. And yeah, but so if anyone has any more questions about histamine intolerance and estrogen, I welcome any comments. It's a huge topic, but basically in a nutshell, you've got to follow a low histamine diet to see if you improve. If you do, you most likely have a level of histamine intolerance, which means you are going to need, while getting some symptom relief with natural strategies, healing the gut, getting some gut microbiome stool testing, and yeah, healing the gut. It's all about the gut. And obviously there are some very specific strategies, herbal medicines, to help more specifically with estrogen clearance and metabolizing estrogen and getting it out of the body effectively. So yeah, thanks for watching. Thanks for those who joined at the end, and thanks for everyone watching the replay. Bye.